You're watching Studio Ken. Make sure you don't miss any episode of Studio Ken by subscribing to the YouTube channel. To subscribe, search for Studio Ken on YouTube, click subscribe on the bottom right of your screen, and set a reminder. You can also watch Studio Ken on Diamond TV on Wednesday at 18:30 and on Saturday at 19 hours. Studio Ken, the home of Kennedy Gondwe, on YouTube.
At the age of 10, her mind was set up on becoming a medical doctor. Her affinity to the American drama series Emergency Room and the presence of her cousin, Professor Sekelani Banda, a medical professional himself, are among the early drivers to her career path. She had no idea what lay ahead, but when she turned 19 and survived an incident of attempted murder, a moment that triggered a bout of post-traumatic stress disorder requiring therapy, it became abundantly clear what her specialty would become. Today, she stands tall among the country's female mental health specialists. With over 10 years of medical practice as a psychiatrist, she has branched off to set a medical facility that seeks to enhance treatment of mental health. Dr. Maria Akani's Chembe is my guest on Studio Ken today.
Hello, this is Uncle Patrick, Chief Security Officer, one-man commando, suicide commando of Nguzu Plantation. You are watching Studio Ken. Don't forget to subscribe. Don't forget to subscribe. Subscribe. Don't forget to subscribe. Bye.
Doc, welcome to Studio Ken.
Thank you for having me.
How serious is the problem of mental health in Zambia?
It's quite serious. We do not have any prevalence studies, but there's been some studies and estimates done by the WHO, which estimates that 1 in 5 would have a mental health problem. And the problem is expected to even double or triple by the end of 2021 because of the COVID-19 pandemic.
What is the relationship between the COVID-19 pandemic and the problem tripling?
So there's been a number of issues. So one of them, for example, is grief. There's been people who've experienced multiple grief in the same family, multiple grief among the communities like friends and so on. Then there's the issue of anxiety and trauma, some from having severe disease and having been in ICU. And then there's things to do with job loss that has worsened during the pandemic. And people who have problems with substance use disorders have, in some situations, ended up using more drugs and alcohol to calm themselves down during the anxiety. There's also been a lot of health anxiety, panic attacks, and problems that come with isolation, like the fact that people had to stay home a lot. So some of it is reduced socialization, not interacting with other people, but some of it is just the fact that a person sitting alone is uninterrupted in a lot of their work. People working from home have had more stress because they don't have those boundaries between work and home. So that transition really helps to protect us and manage us, help us manage stress. But those things have also been broken down. And for a number of people, there's also been increased roles in terms of, like, the homeschooling, managing children at home, still managing work at the same time. So people don't say, oh, you're probably homeschooling, so I'll give you less work. They still have the same kind of work demands. And now I think schools have opened, so that pressure has reduced, but I do know that some schools still have that transition and a lot of online schooling.
How then do you deal with such a burden? Because COVID-19 is not disappearing anytime soon.
Well, there are different things. Part of it is trying to find a regular routine. So routine really helps to bring down anxiety. It helps to manage expectations and get people settled much faster. So that's helpful. The other thing is also managing, for example, if you're managing children, managing their expectations as well. Because if children are anxious and edgy, then parents as well become more anxious and edgy. And then for people who've had to work from home, there are different kinds of recommendations we make. For example, you need to have a designated workspace because you can't just work from anywhere. Remember what we talked about in terms of how it's essential for you to have the boundary between work and home. So at least even if you don't have a room, if you have a corner where you work from, that's helpful. And also still keeping to regular hours as much as possible. So still take your lunch break, get up, leave your desk, get back. Still be able to knock off at a scheduled time so that you can break that boundary and have work and home separate. And then also there's been issues to do with things like Zoom fatigue. So we encourage people to have agendas for their meeting, have shorter meetings which are more efficient, and as much as possible do a lot of actions before the meeting so that meetings are basically just reporting times.
But how about on a personal level? Because in as much as this problem is on the other side in terms of the clients or the people with such conditions, you as professionals are also, I'm assuming, under a lot of pressure because you are having more people coming to you. How are you dealing with that on a personal level? Because these things that are explaining are very much prevalent even in your case. You've got kids, you are married, you've got the job of looking or providing a service to people that have got mental health conditions.
So maybe I'll start from the workspace. One of the things we did was to continue supporting people. Obviously, we have a business to run, so we need to continue the business. And so what we quickly did was move a lot of the therapy online. So we have online therapy, the group therapy, and so on. And before the COVID, before the first case of COVID was recorded in the country, we actually had a team workshop where we did psychoeducation and talked a bit about what happens in pandemics, how are people's mental state affected, what kind of things do you think we will see in our practice, and so prepared for that. So that really helped us as a team. And then we moved activities such as supervision and continuous professional development online. So we're still able to check in and say, okay, how are you doing? How is the stress? How is the workload? And so on. So that we continued to do. When it came to school for my children, it was a bit hectic at first because so my children are small. I think older children, it's easier for them to sort of interact online and get the work. So initially we had like a lot of support in terms of workbooks and so on. But then we had a few challenges later. And so what we did was we then made an arrangement for a teacher to be coming home, the same teacher who we tried to follow as much of the guidelines as possible. And we had her come in. And then still continued with certain physical activities like swimming and music, which don't require a lot of children coming together. So that has been helpful to try and give them a semblance of a normal life and still have learning and activity going on. Yeah.
Now, we're talking about COVID that has just happened, or we're living with COVID right now. But the fact is that Zambia has had this problem for a long, long time. What are some of the factors that time immemorial can be attributed or have been attributed to the problem of mental health?
Alcohol and drug, number one.
Why?
So alcohol and drugs, they are called psychoactive substances. They affect the brain. They affect the way the brain functions. So alertness, judgment, all the neurotransmitters in the brain, they're affected by alcohol and drugs. So that affects the balance and that destabilizes them, causing disease.
And how do you tell that this person has got a mental health problem? Some of them are masked.
Yes. So mental health, when we talk about mental health, we talk about three key aspects: how a person thinks, feels, and acts. So those are the three things that we really focus on. So if a person has a problem with their thinking, judgment, attention, concentration, processing of information, when, information you get from outside and so on, that is an issue to do with mental health. The way you feel is heavily connected to your brain. So for example, depression is primarily a disease of feeling sad. Anxiety is primarily a disease of having a lot of anxiety, and so on. And in bipolar, one of the problems is that a person has an elevated feeling of happiness continuously and all the time. and then acts because ideally there's a certain normal behavior that you expect to see. So when a person is behaving out of the norm, then you can see that those are problems with mental health, because how we behave is really directed by how we think. So when you have a dysfunction in those, then...
At a personal level, I've experienced some of those things that we're talking about. But the problem also comes in because the people with the conditions don't admit. So to them, their behavior is very much normal, and you cannot drag someone and take them to a specialist until they reach such a stage of admitting. How then do you strike a balance?
So there are different kinds of mental health disorders. Some of them, the person actually knows that there's something wrong. And I mean, that's part of the reason why our practice exists. For example, people actually call in and say, I have a problem. I have been feeling sad, or I have been feeling anxious about things that I don't understand, or I have a problem and I'm depending on alcohol to function and things like that. So there's some mental health, actually most mental health conditions, a person is able to tell that there is something going on with me. The problem comes in with the mental health conditions that maybe affect thinking and judgment, for example, because a person in the way they are thinking sees nothing wrong. And in that case, we really rely on the people nearest to them, their family, their employers, their loved ones, to support them through the process.
How do you deal with people that are violent?
Actually, generally, a lot of people with mental health problems are not violent, unlike what people think. They only become aggressive when they feel threatened. That's usually the problem. So you can manage them when you show them that you're not a threat. And that's one of the ways in which you can approach people that are violent. Personally, because I deal in outpatient care, we rarely deal with people who may be aggressive or violent. But in an institution, there are ways in which nurses are equipped to handle somebody who is violent. First of all, de-escalating without using any physical means, helping the person to calm down. And then after that, if the person is then attacking and so on, you can then restrain them and you can sedate them.
Where does the law stand in all this? Because I've seen situations where someone is violent, you take them to the police, and the police say it's at owner's risk, we can come, because the law doesn't protect us.
So according to the Mental Health Act, the recent one, which is the 2019 one, basically, in the same way you deal with mental health conditions, you should take responsibility, physical conditions, you should take responsibility for your mental health as well. So nobody would drag you to the hospital and say, you need to have a diabetes test, I think you have diabetes, and therefore you need to go through treatment and medication. But the law protects you if you're a danger to yourself or a danger to someone else. So for as long as you're not a danger to anybody, they cannot intervene. And so
but where you are a danger to yourself, as well as the next person, naturally, the next point of call would be the police.
Yes.
And the police say, no, we can't come.
So they need to have a court order from the magistrate, which can then which can then give them permission to do that. Because can you imagine if the police just used to do that all the time? Like, people would literally just pay them money to pick up anyone who they find annoying and have them locked up. So there needs to be a magistrate order to show, and when you're getting the court order from the magistrate, you need to show that there were different things that were looked at that made the person question your judgment before the police can then act. So that they...
Yes, I get you. I guess the point that I'm trying to make is that you can get all that. You actually even go to the police and say, here's a court order and we want your intervention. But the police would then say, no, we can't, because when we go there and we are attacked, the law doesn't protect us. So people are left to fend for themselves.
Oh.
Yes.
Okay, that's something I don't know about, because I think my experience in working in mental health is that we've received a lot of clients from the police who the police have helped in the community to bring to services, because they received a court order, and sometimes they didn't even get a court order, and they just brought the person in.
I think it's different experiences. Yes, there are cases, to be honest, where police have been helpful, because I've experienced this, but there are others where you go to the police, you move from one police station to the other, and they tell you this person will attack us, and we don't want anything to do with your case. You deal with it. But anyway, let's move to the next question. Zambians, by and large, are very spiritual, and sometimes when you've got such cases, the next point of call usually would also be your prophetesses, your prophets, church people to pray. Where's spirituality in all this? People have gotten rich as a result of praying for others, and yet the problem doesn't even go away.
I think there is a misunderstanding of what happens when people have abnormal behavior. So there's a general recognition that if your skin dysfunctions, you can get a rash. If your nose dysfunctions, you can have a runny nose. If your lungs dysfunction, you have problems breathing. But there's no recognition that if your brain dysfunctions, you will have disordered behavior or speech and all those things. And so I think that that's something that's very cardinal. Somehow people do not relate mental illness to the fact that there is actually a brain, an organ that's supposed to control your behavior and thinking and so on, which can dysfunction. And so you find all kinds of explanations coming out as a result.
So at what point do you tell that this is demonic, a demonic attack, versus this is a mental health problem? Because you go to these church people, with all due respect, we're Christians, but there are so many of them that are bogus, and they'll prescribe all manner of verses over a mental health problem.
So I'm a Christian myself, and I think one of the anxieties I had about getting into mental health was just that, like, how will I know that this is somebody who requires deliverance and this is somebody who requires medication? And I remember one elder saying to me, just remember that you're there as a doctor. You're not there as a pastor. That has helped me a lot. So every time I see a client, I focus on the symptomatology. So this person has come with these symptoms. What are the issues? And interestingly, every time there's been a social issue that a person either needs counseling for, a drug and alcohol problem, the person had maybe some injury in their brain, there's been a direct relationship with the brain.
You talk about a personal experience there, and just checking you out, at the age of 19, you experienced post-traumatic stress disorder, and you had to get some help. Tell me more about that.
Okay, at the age of 19, I was attacked by a garden boy. Essentially, he tried to rape me, but it was a very violent experience. I think it was violent anyway, because he strangled me. We fought. At some point, I tried to get a knife and stabbed him. And then, you know, in trying to fight and leave that scenario, I tried to climb the fence, and I had some cuts on my hand and so on. So in the whole scenario, called for help, rushed to the hospital, got some stitches, and so on. Following that experience, I had a lot of fear, a lot of nightmares, and by then I didn't even know that there was such a condition called post-traumatic stress disorder. And I just noticed that I was always afraid, always sad, and I didn't like the feeling of being out of control. Like all of a sudden I felt like I was very vulnerable and anyone could attack me and anything terrible could happen to me. And so the first few weeks were a lot of weeks spent in feeling like I'll get over this. But slowly I found myself being crippled, like literally crippled in doing anything. And so I decided to go and see a counselor, a professional counselor. And he's the one who started now getting me through the process of understanding what it was that had happened to me, my sense of basic trust that, you know, every person has what is called basic trust. If you get into a shop, you give them money, you expect them to give you goods. You don't expect them to just suddenly say, no, you didn't give me money. Like, no, but I just gave you, no, there's no evidence, you know, that basic trust that, you know, when you say hello to someone, they'll answer back and they won't insult you. And that was disrupted. So it took some time to get to a reasonable situation. And even after I did, there's still some things I changed about myself. For example, how I would, so because I was a student on campus at the time, it then meant that when I went to campus, I wouldn't go to a guy's room unless I was with someone. And I always locked my door and so on. And even when I was dating, I would be one of those very particular about going to a guy's house and so on, and going out at night. And yeah, so some things have still changed about me, but I no longer go through the terror that I used to experience, the nightmares, the poor appetite, and so on.
But Mr. Schembe finally won your heart.
Yes, he did.
How did he do it?
Well, it was many years after, and I had recovered from that. So a lot of different things had happened after that. So it was easy for him at the time that he met me.
Okay. On a much more serious note, how did your experience at the age of 19 change your career later on? Or shape you as a person?
I think it definitely shaped me as a person because, first of all, it's just the recognition of how experiences can cripple you. I think that's something that people belittle. They talk about, you know, if you're having a mental health problem, just be strong, just get over it, just do some positive thinking. But I would tell you that I think I'm a very strong person. My family says that. I'm a very strong person. I'm a determined person. And I wanted to recover. But it wasn't just something that I could just get over. I really needed someone else to come into my situation and help me to understand things differently and to recover. So that has helped me to be more empathetic when I deal with people, because I recognize that mental health is a real condition which requires treatment in order for people to thrive, no matter how strong they may be.
You recognize that it's a serious problem that needs attention.
Yes.
You experienced that at the age of 19 also. What is your general assessment then of the situation in Zambia, other than the statistics that you shared earlier on?
Well, I think we have a lot of mental health problems in Zambia. I think that, you know, we are still lacking in service provision. There's a lot of services that we need to have. We still don't have, you know, like in a developed system, for example, you need a multidisciplinary approach. So you have the psychiatrist who gives medication, and you have the nurses. You should have a psychologist as well while you're going through your recovery, giving the therapy. But you also need the community mental health nurse to follow you in the community, your family involvement, the social worker, and so on. And some of those people are not there. So already that affects the mental health system in Zambia. Problems are there, a lot of them.
The one place that people remember or associate mental health with is Chinama. Stigma is associated with that place, isn't it?
Yes.
What can be done to fight stigma?
I think that one of them is just the recognition, the understanding of what mental health illness is. And that, I always say, you know, for as long as you have a brain, you're at risk of getting a mental health illness. So if people can understand that, then there'll be no place for judging. How do you judge someone with if you're also at risk? So I think that's one place to start from. So the awareness is also important. But I think the availability of services in primary healthcare settings also helps. Because if a person in Kitwe has to go all the way to Ndola or Chinama to get a service, that's a problem. But if the services are right there where they are, it's easier for people to access the service and not have to think it's a big problem, I'm even being referred to a big institution for this.
But also, in the recovery process, or even when one has fully recovered, they are still called or referred to as Chenze Chinafu Ntachija, that person was once mad. How important is stigma in that process? Because you can easily flip or slip into that condition again.
Yes, you're absolutely right. And those are some of the things which affect. So there's one of the theories, maybe not theories, but the trends we see in mental health is that somebody with very severe depression is less likely to take their life because they don't have the energy for it. But as they recover, as they see what the condition did to them, did to their relationships, and maybe they've even lost their job or they did some embarrassing things, then they tend to be more depressed. And that at that point is very dangerous, because that's a point at which a lot of people have taken their life.
In your own ways of helping fight mental health or curing the problem, you formed Renaissance. Tell me more about this organization.
Well, it's basically a private practice where we do counseling, psychotherapy, coaching, and training. And the idea is it's an outpatient service, and it offers both the clinical, the pharmacological interventions, which is medication, and the non-pharmacological interventions, which is counseling and psychotherapy.
And when you look at the period that you've been in existence, how are the statistics like? Are the numbers forever increasing of people that you're attending to?
Yes, we have been attending to more people. We've been growing as a team, but we've been definitely attending to more people. We will be 5 years this year, and we've every year been attending to more people, and we still have more that we could attend to.
And when you attend to them, do they still come back? Would you say, whilst you are attending to them, the problems are actually reducing, or you are having repetitive people still seeking your services?
So maybe let me explain a little bit about mental health conditions. You know, when you look at physical conditions, there are people who have malaria, and then you treat malaria and they go. It's unlikely that a person will come back and have malaria again next week. There are people who have hypertension. You treat the hypertension, but you have to keep following them up, just like diabetes. Mental health conditions are like that as well. There are some which are one-off, you know, and some maybe they just end up with postnatal depression. You treat them and they go, and they likely won't experience another episode unless maybe they have a child. But some will end up going to progress into depression. Then there are some conditions you have to keep following up. The key or the goal for us as mental health service providers is to help you to be as productive as possible and to have as much control of your life as possible. That may mean you taking medication. That is fine, because that's what everyone else does with every other condition anyway.
And from where you stand, lastly, what does the future look like in as far as mental health is concerned in Zambia?
Not just in Zambia, but generally in the world, trends are that people have recognized that actually we can't speak about any health in general without talking about mental health. Previously, the issue was treat disease. Then we moved from an issue of saying treat disease to saying let's go into the communities and help people by doing public health, okay? And then people then realize that, no, it's not enough. That's why WHO no longer says health is, they talk about health as a sense of well-being more than just physical, but spiritual as well, emotional, and so on. And they realize we can't talk about health without talking about holistic health. And the most holistic organ you have is the brain. So in the future, we will see more integration of mental health services into regular practice, because that is what has been noticed to be the most effective way of treating any health condition, actually.
And how about drugs? Some of the drugs that people require are not readily available in Zambia. And in cases, some cases where they're available, they're very expensive, by far more expensive than the ordinary person can afford.
Mm-hmm. That's true. There are some medications that are affordable, but like you said, some medications are very expensive. We look forward to a time when, you know, like ARVs, which before were a privilege of only those who could afford, but now it's a situation where through different donors and programs and the government's activities, the drugs have been made available to the general populace. So we look forward to a time when that will happen. With the fact that we have a new Mental Health Act, as soon as I think the Mental Health Council and Tribunal are put in and the government is then put to be accountable to that, I think we will see some changes in this nation.
Thank you very much, Doc, for hosting us.
Thank you for having me.
Hello, this is Uncle Patrick, Chief Security Officer, one-man commando, suicide commando of Nguzu Plantation. You are watching Studio Ken. Don't forget to subscribe. Don't forget to subscribe. Subscribe. Don't forget to subscribe. Bye.